So, Nitin, thank you for the generous introduction. What I'm going to be talking to you today about is a no-flap refractive surgery where only a femtosecond laser is used with the elimination of both a microkeratome and an excimer laser. I'm a consultant for Carl Zeiss and I have been instrumental in development of this particular technique. What a relaxed smile involves is an all femtosecond laser vision correction technique where no excimer laser is used. So you use the femtosecond laser to carve out a lenticule within the corneal tissue, which then can very easily be removed through a small incision. This is a technique which is definitely going to be the future. At the Center for Sight New Vision, we have started these studies in August 2008. And so far, we've treated more than 5,000 eyes in the last 6 years. I would just like to show a small video of the procedure so that you would understand why I'm raving about this procedure. What we use is a Visumax femtosecond laser which sits on the cornea, so it does not cause any pressure rise to an extent where you can't see this green blinking light. The first pass is more posterior and it is followed by a side cut. The second pass is more anterior. It starts from the center, goes to the periphery, and it is followed by a very small incision. This is a sub 3 millimeters incision. When you do this, you have a separated tissue within the corneal stroma, which you then can very easily separate out with a blunt instrument. The Visumax has an attachment of a good microscope. So you can just take your patient and put it under that microscope so that these planes are very easily visible. I'm right now above the lenticule and you can see I'm just passing a blunt instrument and it breaks all the bonds between the bubbles. Then you go and find the posterior plane and enter in the posterior plane. The anterior to posterior part of the lenticule is separated by the refractive error required to be corrected. So once you have both surfaces separated, you can see no subconjunctival hemorrhage because it's sitting only on the cornea. You can see the footplate of the contact glass. So once you have separated both the planes, you can very easily remove that lenticule through that small incision, leaving the cornea actually smiling back at you. So you don't need to enter into the eye, you don't need to create a flap, you don't need to weaken the cornea. So the remarkable aspect of smile is the predictability, accuracy and stability. And this aspect of smile has not changed right from the beginning. So even in the first study, we showed the same amount of stability, predictability and accuracy. Now there are lots of changes that has happened over a period of time. We have been able to get better energy and spot parameters, different scanning pattern, higher frequency. We moved from 200 kilohertz to 500 kilohertz and a better surgical technique and instrumentation. And we have more than 98% of the eyes within plus or minus 0.5 diopters of intended correction. And this was even in the first 1,000 cases done in the world, which is comparable to what an excimer laser can give even today. And this is born out of several studies. A study at Japan showed that 100% of the eyes were within plus or minus 0.5 diopters at 6 months. Our own study reported 95% of the eyes at 6 months. And at Denmark, a study which was done showed that all eyes were within plus or minus 1 diopter. 95% of the eyes were within that range. And why would this happen? This happens because you are not using an excimer laser, which works by photoablation. And photoablation is limited by a lot of factors. When you do a photoablation over the tissue, it is limited by the factor of humidity in that tissue, humidity in the surrounding area, the organic vapors, the depth at which you are working on the cornea, and so many such factors. And this would specially result in a scatter, especially for high myopic treatment. Relax instead uses cutting, and therefore you either cut or you don't cut. So whenever it cuts precisely, and therefore there is much less influence of any external factors. Also, you would find that the total amount of energy input into the eye with relax is less than with femtoLASIK, which results in less inflammation and a better stable treatment. There was a very elegant study done in Singapore which showed that for all depths of correction, while LASIK showed more and more inflammation, relax showed the same amount of inflammatory reaction. And this results in better safety and stability. As you can see, there is an incremental increase in the uncorrected visual acuity or the best corrected visual acuity in SMILE, while in femtoLASIK it sometimes shows fluctuations. As regards stability, the results are really stable in SMILE as compared to again femtoLASIK, and this is a high myopic group. We ran a study in 25 patients where we did one eye femtoLASIK, the other eye SMILE, and all these patients had more than -6 diopters. So we had the same amount of myopic error correction, the same parameters, and the same wound healing response. And we found that the stability was in SMILE was much more. So what we got at 1 week was 0.04 diopters, while at 9 months it was 0.2 diopters, a change of 0.16. While in femtoLASIK it was 0.11 to -0.5, which was a change of 0.6 diopters, a statistically significant result. Though the efficacy didn't show a statistically significant result, it did show some gain in the letters of ETDRS. And this came with no more induced aberrations. And in a study we conducted, we saw that it was less than 0.12 microns in a 5 millimeter pupil, which was also seen in this vase, where you can see the point spread function in SMILE is much better than in femtoLASIK. The image simulation also, if you compare one eye femtoLASIK, the other eye SMILE, you can see a much better profile here than here. And when you are comparing the optical zone, you can make out that this is a SMILE eye as compared to this one, which is a femtoLASIK eye. You can see a clear 6 millimeter zone if you've tried to create one. And we found that there was an impact of cap thickness. So because you are not creating a flap, you could go little deeper and spare the anterior layers, which are the strongest layer, and you could then maintain the corneal hysteresis. This is 1 year C8 study where in one eye we had done a 90 micron cap, the other eye 140, and we found again a significant difference between the two eyes. In a 5-year study, we found that we had almost, now we have seen about 125 eyes at 5 years, and we've seen that there is an increase in the best corrected visual acuity over 5 years, where we had little losses in the initial stages. They have also been covered up because the epithelium must have covered all that irregularity which were there. And later on, of course, there were no, because of the change in the scanning pattern, we had been able to address that issue. So now over 5 years, we find the stability to be remarkable. There is no change in refraction. The efficacy to be, again, really commendable. You would see that all patients are more than 20/25 or better, uncorrected visual acuity. And we also found that 100% of the patients were within plus or minus 0.5 diopters. Thus, it shows remarkable efficacy, safety, and predictability. And the changes over 5 years are also showing the same things, which means that it is a paradigm shift in the way we can do refractive surgery today. So it has come to age, and I'm sure that all of us in future would be smiling with our patients' eyes smiling. Thank you.